Hello and welcome to 5-Minute Sociology. Now today I want to talk about the social model of health. Now in a previous video we looked at the biomedical model. The social model can be seen as a direct reaction to the biomedical model. So you might want to revisit that video as well. Now the social model of health can be seen as a direct reaction to the biomedical model. And in the social model, we're thinking about the wider social context of a person's life and why that could lead possibly to ill health or other issues in their life. So if you think the biomedical model looked at the individual, it was trying to find the root cause of an illness to fix it. Now the social model would go wider and look at the surrounding factors of an individual's life. For example, the biomedical model might look at the person's housing situation, or they might look at lifestyle factors such as smoking, drinking, drug use, education, location, all these things. Are they in an inner city area? Are they in an area of high pollution? So it really looks at the wider social factors that would lead a person to be ill or experience illness. And this model is used within sociology and also in nursing and medicine as well. So I say it's a direct reaction, but also we could see it as a complementary model to the biomedical model. And certainly practitioners like social workers would employ the social model of health. Okay, so the reason the social model of health came about was because we had the biomedical model, we had the Enlightenment period where we saw a rise in science and science being used as the basis for medicine. But then researchers began to realise that there's a direct link between where someone lives and their living conditions and their health. So in the early 20th century, when housing and sanitation improved, there was a direct correlation with the improvement of health. Okay, so this is why the social model of health is so important in things like policy making and housing policy and things like that. Particularly famous case study, which is a good example to use, by a physician called John Snow. Now, John Snow was a British physician, and he's often hailed as the kind of father of epidemiology. So this kind of links in with public health and things as well. But essentially, John Snow in the 1850s monitored a cholera outbreak and kind of pinpointed where this outbreak was happening. So very primitive epidemiology. And what he was able to work out, that there was one particular water pump appeared to be the source of the cholera spreading. So what he did was he removed the handle of the water pump and then mapped again, and he saw that the cholera reduced, the rates of cholera reduced. So that's just a little case study that's good to use to show the impact of the social model of health. The other point that we could mention is that if you look at any statistics, so students out there that are wanting to research and look at statistics, I suggest you look at the Office for National Statistics if you're in the United Kingdom. And if you look at any life expectancy graphs and projections, you'll see that life expectancy is on the up for both males and females. There is obviously a slight difference in male and female, with females living longer than men, but we'll look at that in another video. The way I always try and teach it and explain it is, if we think of the biomedical model, that's kind of looking inward at the person. Okay, so if we imagine, they've got an illness, needs to be treated, so it's very kind of individualistic, looking at the person. The social model would see the wider context and the world as the problem. So if you imagine a kind of a stick man, the biomedical model will be kind of looking in, the social model would look out. Okay, so the social model would think about things like why can this person not access a service? What's stopping the person from accessing it? Where are they living? What's their education been like? Do they use drugs or alcohol? It would look at these wider factors to try and build a picture, whereas the biomedical model tends to just look at the individual and treat the root cause of the illness. Now, I mentioned some professionals using it. So the biomedical model, you would see that within the NHS, and if you went to a GP, you would see them use that. The social model of health would probably be employed once you were referred. So, for example, if you were going to see a social worker or a counsellor maybe, the social model of health would be employed there. Okay, so just to really quickly sum it up, the social model of health is a complementary model to the biomedical model. It's a reaction to the biomedical model in the sense that it is the opposite really of it, because it looks at the wider social factors of someone's life. It'll look at housing, education, environment. It will try and work out why someone is ill based on what's going on in their wider life, whereas the biomedical model would purely look at the individual. Okay, I hope that's been helpful. Thank you for tuning in. If you enjoyed this video, please give it a like and think about subscribing to the channel.